Many people in Ghana have had bad experience at the hand of a nurse, midwife, or other health workers. Many of these cases changed the lives of the victims for the better or worse. On many occasions, the repercussions are dire. Some victims never live to tell their story. In sub-Saharan Africa and Ghana in particular, women still die in childbirth. This is unacceptable. To reverse this trend and promote safe pregnancy and labor, the Ministry of Health, Ghana Health Service, and other stakeholders have introduced several measures. But how many have worked? About 130 million babies are born annually. Of this number, over 3 million die within the first 4 weeks of life, and another 4 million are stillborn. And these babies are not counted, and their families grieve in silence. We can bring joy to families if we promote maternal, infant, and child survival with excellence. Let us all promise to save lives. These are the words of the current Greater Accra Regional Director of Health, Dr. Linda Vanutu, who has done so many things to make sure that this dream is realized. These figures, has anything changed?
Thank you very much. We realize that over the years, a lot of effort has been put into saving mothers and babies. And I'm sure you are aware of the Millennium Development Goals that specifically looked at reducing maternal deaths and also reducing child deaths. And because of that, countries all over the world, communities, facilities put in so much into reducing these deaths, which unfortunately occur. So we realize that there has been some reduction, and Ghana is one of the countries that also committed to ensuring that maternal mortality is reduced and child mortality is also reduced. So some work has been done.
So I promised myself to find out more. My journey to know more started with an encounter with a young midwife in charge of one of the CHIPS compounds in the Shai Osudoku district. Comfort Abire told me she squats with women in labor because they refuse to go the conventional way.
At my place and here like this, most of them come in labor preferring the squatting position. So when they go in labor, you also go in labor. We squat with them for them to put their hands on our knees. And then they hold you, they use you as a firm support, and then they can push.
Then I learn about how peculiar the Shai Osudoku district is. It is part of 16 metropolis, municipalities and districts that make the Greater Accra region. It is the largest district in the region, located on the southeastern part of Ghana. It has a land size of 1,522 square kilometers.
Our district is huge. Yes, it's huge. 60,971 population. This population is a population of a sub-district of another smaller district. So they have to walk distances, and you don't have money to give them. You don't have motorbikes to give them. But I'm really proud of the teams.
Health needs of the people here are like any other across the country. Fortunately, there is a twist to the situation at Shai Osudoku district.
At the same time, family planning now time set there will be.
I learned for the first time that nurses move from house to house to attend to the health needs of residents. Key among the targets of the Health Directorate here is to ensure that no woman loses her life giving birth. Dr. Kennedy Brightson is the medical superintendent of the Shai Osudoku District Hospital.
So it's a man, anybody. It's a man. Okay. So the post-operative cases, they are here. But like I was saying, we don't reject patients. So we have patients on the floor. We have patients on the floor. We do not say that we don't have beds. So when you look at it, it's a student's mattress. And we got 10 from NATMO, National Disaster Management Organization. Mr. Ajakli was kind enough to us. We called him. He gave us this. These are post-op cases. We just finished operating them. You know, this was the first case, right? Okay. So this is on the floor. We would manage. When I wake up from home and I'm going to the hospital, there is one prayer I offer. And it's like people ask me, so do you pray? I say, I don't pray a lot. I just have a short prayer. So one day I was asked, what prayer is it? I said, God, use me again today to save as many as you want to save.
What a powerful prayer. I like the prayer. It's so short.
Finish. There's a lot of pastors have been deceiving them. And it becomes a big problem. So they go for prayers, they don't come for clinicals. But when the prayers get to the peak and what they are expecting does not happen, and death begins to stare at them, then they are rushed to the hospital. We save them. We save them. But we suffer to save them.
Like Dr. Brightson, the Greater Accra Regional Director of Health has her own promise. In 2008, Dr. Linda Amaka Ivanotu developed the PROMISE model. The PROMISE stands for Promote Maternal and Infant Survival Excellence. It was developed out of a desire to identify the reasons for the high number of stillbirths and maternal deaths recorded in the western region of Ghana, where she was the then Regional Director of Health.
So as a regional director, with my team, we had to find out why these babies and mothers were not surviving pregnancy. So what we decided to do is what we call the PROMISE. And PROMISE basically is ensuring that we offer care to pregnant women and their babies, and also involve the families and the community as best as we can. And one of the things that we did was to have what we call the PROMISE drivers. Okay. You know, we've always talked about the 3 delays that contribute to maternal death, that contribute to child death. The delay in the person seeking care, the delay in getting to the health facility, and the delay in giving the care when they have gotten to the health facility. But I